My name's Tom Quick. I'm a consultant surgeon in the nerve injury unit at the Royal National Orthopaedic Hospital. So the clinical question that we're faced with is trying to understand and image nerve regeneration. When nerves are damaged, often the distal part of the nerve, the bit not connected to the central nervous system, dies, decays away. The central part of the nerve then tries to regenerate, to regrow, to reconnect with the distal organ, with the muscle or the sensory organ. The rate of this regrowth is not entirely known. We think it happens at about 1 millimetre a day, 1 inch a month, but we've never seen this, been able to see and image this regrowth. What we're hoping to do is to find a process that can allow us to see that regeneration and to measure the speed. There's a clinical test called a Tinel sign, whereby we're able to tap along the course of a regenerating nerve and the patient can report the sensation of tingling in the distal territory. If I were to have cut my radial nerve here and tap, my brain would tell me that there's tingling in the distal territory here. As the nerve regrows and tries to reconnect, the tingling point will move forward 1 inch a month. So in a month's time it'll be here and then here and then here as that nerve regrows. We don't know, and we've never seen that process happening, and we don't know exactly whether all of the nerves are regenerating at that same speed. So what we're hoping to do in a non-invasive way with patients with natural regeneration and after nerve surgery is to see that process of regeneration occur. What we'd hope to be able to do is use this test to be able to indicate where surgery is indicated, and also to be able to know and predict the speed of outcome and the quality of outcome. I think now's the time to hand over for Ivana for more of the technical aspects.
My name is Ivana Drobnjak and I'm a lecturer at the Center for Medical Image Computing and the Department of Computer Science here at University College London. The main aim of this project is to develop cutting-edge microstructure imaging techniques and use them to non-invasively image peripheral nerve system. Microstructure imaging techniques are kind of composed of a few different components, which include the diffusion MRI, then mathematical modeling of the peripheral nerve tissue, and also using computational methods for the optimization of the diffusion MRI sequences, and finally estimation of the tissue parameters themselves. So what we are really interested in are the parameters of the tissue, such as, for example, the axon diameter, the axonal density, and the orientation of the axons in the nerves of the peripheral nerve system. So we are interested in these parameters because if we can image them non-invasively, then we can actually then assess the nerves themselves, whether they are normal, whether they are damaged, and also we can assess how is the repair happening in the nerves.
So this project brings together the great strengths of the Royal National Orthopaedic Hospital's Nerve Injury Unit, which is the largest of its kind in the country and unique in the world in offering purely attention on nerve injury treatment. It also brings into play the amazing power and strength of UCL in its neurology, neuroscience and engineering departments.